Greetings. In this video, we will learn about choledochal cyst. So, choledochal cyst is a congenital, that is, it is present since birth, in which, because of development problems, there is abnormal widening of the bile ducts. So, let's try to understand how does this bile ducts they help in our body. So, as we all know, if we once we ingest our food, it is digested and it is because of lot of enzymes which then break down this food into smaller forms which can be absorbed by the body. So, two most important organs which help in digestion are the pancreas, and this is the pancreas which secretes the enzyme, and the liver. So, what does liver do is that liver secretes a fluid which we call bile. Now, this bile helps in the digestion of fats. So normally what happens, you must have heard about gallbladder. So our liver keeps on secreting this bile, but we don't require this bile always. So it is stored in an organ called gallbladder. And once we ingest food, our gallbladder contracts and this bile then reaches into the small intestine and it also joins the the fluid from the pancreas and they both open into the intestine and help in digestion. So what another thing that controls the these two secretion or these two juices are presence of a muscle around here as soon as it enters the small intestine, which prevents the movement of these juices into each other. So the pancreatic juice, the juice which is coming from the pancreas, will not enter these green bile ducts otherwise. So in choledochal cyst, what happens is that the pancreatic duct which drains the pancreatic juice and the bile duct which drains the bile from the liver, they join in an abnormal fashion. And because of that, the fluid or the pancreatic juices can then enter the bile duct. Now these juices are enzymes which are able to digest and break down things. So they can cause weakness in the wall of the bile duct, which then widens up and which is then perceived as choledochal cyst. So how does choledochal cyst present? So the choledochal cyst nowadays, because this is a problem which is present since birth, and most of the mothers have antenatal ultrasound being performed. So since now a large number of cases are diagnosed on a ultrasound which is performed in the pregnant mother. And once the baby is born, we know that the child has choledochal cyst. But if somehow it is missed, then these patients may present with jaundice, that is yellowing of the eyes. Now this happens because of this dilatation there is a decreased flow of bile into the intestine, and because of this obstruction the bile accumulates in the body, which is perceived as yellowing of the body, which we call jaundice. Another dreadful complication of choledochal cyst is that predisposition to cancer. So if the choledochal cyst is not operated early on in life, later on there's high chances of cancer being formed in this abnormal dilatation of the bile duct. So how is choledochal cyst diagnosed? Like I mentioned, ultrasound is able to diagnose the choledochal cyst, but to see clearly the choledochal cyst and its anatomy and its communication, often an MRI is also performed. So after the MRI, the choledochal cyst is then classified into various types depending upon how it looks and how extensive is the widening or dilatation of the ducts. So not to confuse you, but I'll just mention the two types that are most commonly seen by us. The first one is type 1 and the other one is type 4A. And this distinction is important because the complication rate later on in the life can be more in patients who had this type of a dilatation. And I'll explain how. So in type 1 choledochal, the dilatation is limited to the ducts which are outside the liver. So the duct which is transporting the bile from the liver, outside the liver, to the intestine, that area is dilated. Whereas in 4A, that area which is outside the liver is also dilated, but the bile ducts which are inside the liver are also dilated. Now the problem is once we are operating this patient, we can remove only the ducts which are normal and dilated and outside the liver, but we cannot operate upon the ducts which are deep inside the liver. So the treatment for choledochal cyst is surgical, in which we remove the abnormal part of the duct that is widened, that is the choledochal cyst, along with the gallbladder. We also have to dissect or divide the cyst in toto so that there's no abnormal part of the cyst left because it can result in later in complications like stone infection or cancer. So the normal part of the uh, bile duct, that is choledochal cyst, is removed, and after that we have to restore the continuity of this bile duct with the intestine so that the digestion of food takes place. Now, this restoration of continuity can occur by two methods, and both methods are equally good. And the procedure performed may depend upon the comfort of the surgeon. So, in the first procedure, what is done is that a part which is more away from the stomach, part of the intestine, which we call jejunum, is brought and it is then joined to the bile ducts. So this part is brought up and joined to the bile ducts, and this area is again joined together so that we have the continuity so that the food that enters the stomach can then go into rest of the intestine. So this is called hepatico-jejunostomy because we join the liver with the jejunum. The other, the second procedure that is performed is in which the part of the intestine which is just after the stomach, which we call duodenum, is attached to the bile duct directly. So we call this procedure hepatico-duodenoscopy because the duodenum is attached to the liver. Both these procedures can be performed safely through laparoscopy or keyhole surgery, in which 3 to 4 incisions of varying lengths, 3 to 12 millimeters, is given in the abdomen and the child is operated. So let's talk about the complications. So whenever we put suture, although we are meticulous about that, but sometimes some degree of leak of the bile can happen at this anastomosis. And in most cases, it is self-limiting and no further surgery is required. But sometimes, very rarely, the child may require another procedure to handle this leak if it is very, very significant. Second complication that can happen, which happens a bit later on, is stricture, in which the sutures that we place and the hole we create narrows over a period of time. Now that when it happens, again there is a dilatation or widening of the ducts of the liver, and the child may again have the symptoms of pain, jaundice, or infection. The another complication that I mentioned earlier, and which is much more common in patients who have type 4A choledochal cyst, in which the part of the ducts which are inside the liver, which we are unable to remove, are infected, or they develop stones inside their lumen. So again, these children may present with pain, fever, and jaundice.
With
I
this, we
hope
come to
you
the
were
end of
able
this
to
video,
understand
and
about
hopefully,
choledochal
we could
cyst
help
through
you
this
in
video.
understanding the
Thank you
disease
for your time.
process and the management of your child.